Hello and welcome to the federal webinar. India reports the highest number of suicide deaths in the world. According to the National Crime Records Bureau, India recorded over 1.64 lakh deaths due to suicides in 2021. That's last year alone. That's an average of close to 500 suicides every day in the country. A sharp rise in suicides has been noted in 2020 and 2021 as compared to years before the COVID-19 pandemic outbreak. It was in 2020 and 21 that the number of suicide deaths in India spiked to over 1.5 lakh mark. These numbers are quite depressing and very alarming. So are we condemned to live with suicides? Or is there a way out? Can various stakeholders like the doctors, police officers, and media personnel come together to bring down the rate of suicides in India? That's exactly what we are going to discuss today. That's the question we are asking in today's webinar, and we have experts from across these sectors to try and find an answer to this question. I welcome our panelists to this webinar, and for those who have tuned in to the show on YouTube, please do subscribe to the Federal's YouTube channel. You may also post your questions or suggestions in the comments section below, and we will go through them towards the second half of the webinar. Now, let me quickly introduce our panelists to our viewers. We have with us the dynamic Police Commissioner of Coimbatore, Mr. V. Balakrishnan, who has worked extensively on the issue of mental health and related subjects, both in the community he works as well as within the force. We have Dr. Safia MS, a psychiatrist and a mental health expert who was instrumental in the federal looking at this topic closely and putting together this webinar. Welcome, ma'am. We have Dr. C. Ramasubramanian, who is also a member of Tamil Nadu government's Police Commission. He's also a renowned psychiatrist and a mental health expert who has been working with various communities for over 3 decades. To look into the media and media communication aspects of suicide prevention, self-harm, and mental health, we have with us senior journalists Kavita Muralidharan and Saptarishi Bhattacharya. And I, Prem Shankar, will moderate this webinar. Thank you all for joining me on this webinar. The format is very simple. We will take opening remarks from each of the panelists for about a couple of minutes, and then we will throw the floor open to discussion. Through the discussion, we will dip into questions and suggestions from our viewers, and we will also we will be ending this with closing remarks of each of the panelists. So thank you once again for joining us. And Dr. Safia, may I begin with your opening remarks, please?
Thank you. So this year's theme for Suicide Prevention Day is creating hope through action, which directly talks about our need to instill confidence, inspire, and to bring in light in each one of our lives. And that can happen only through a collaborative efforts, because there are so many stakeholders in this particular, in this goal, what we have set for ourselves. The good news is suicide is a preventable cause of death. And with all of us coming together collaboratively, cooperating with each other, we will be able to bring in a process wherein we can prevent a lot of deaths in the future. And that is the agenda which we have.
Thanks for laying out, Dr. Safia. But again, coming back to even in your opening remarks, I mean, you're saying that it is a preventable cause, but you think that the emphasis this time around should be on various stakeholders, which is why we have people from across sectors coming. You think that is the most important emphasis that we should lay on?
Yes, yes. So how we can prevent by all of us joining hands is what we need to find out. So how can we hold hands together so that we can prevent, and that's the only way out. One doctor can't do anything, only the police department cannot do anything, awareness cannot do anything. There has to be a collaborative work from an individual, intersectorally, interdisciplinarily, organization-wise, nationwide. There's a lot of things which we have to do collaboratively to prevent and to stop or decrease the number of suicides. And as the theme goes, we have to create hope in the hopeless through action, and it has to be visible.
Thank you for elaborating it further, Dr. Safia. Sir, Mr. Balakrishnan, sir, I would like to understand from you when we are laying down this basic the fundamental principle of all of us coming together to prevent this prevent this issue. Your opening remarks on that particular aspect.
Yes, thank you, Prem. First of all, I appreciate and thank you for organizing this webinar, because it's such an important issue facing all of us today. So when we say suicide is preventable, I completely agree with Dr. Safia. And when we say it is a preventable problem, then police comes into picture. Like, Indian Police Act has duty upon the police to take all the measures to prevent any kinds of offenses, any kind of crime. And if we look at the loss of life through suicide is an offense, then we come into picture and we have the responsibility to take measures to prevent commission of suicide. And when we say prevention, it is not only, as rightly pointed out by you, it is not only the duty of the police officers. Of course, it is not possible also. Police alone cannot prevent suicides. And essentially, there are so many stakeholders involved in this, for the simple reason that if we consider suicide as a mental health issue, a mental health issue is such a complex issue where the involvement of various departments, essentially primarily the health department and then all the associated stakeholders, they all come into picture. And I'm happy that the panelists are representing various stakeholding relating to the suicide and its prevention. And when it comes to prevention, again, if we look at suicide as a mental health issue, there is always a trigger and a response. There may be any number of triggering factors which prompts, which triggers a person to take a decision to end their life, right? So between this trigger and response, there could be intervention. Now, from the policing point of view, what I look at it is, we have, based on the data we have, based on the data on causes for commission of suicides, we know fairly well what are the general triggering factors for the suicide. So as a police officer, I look at the police role in identifying those causes and trying to address those causes through by coordinating with the various stakeholders. That is one point. The second point is intervening between the translation of trigger into action, the triggering factor leading to decision to commit suicide. So there also it is possible to intervene. So intervention can be at the triggering factor and between the trigger and response. That is how I look at it. And during the course of discussion, we'll be discussing about the common triggers we have identified based on the data we have, and how to delay the decision, how to widen the gap between the triggering point and the decision to commit suicide. If you can postpone, if you can widen the gap, time gap between these 2 points, definitely we'll be in a better position to intervene better and postpone the decision. And it definitely helps in prevention. So during the course of discussion, we'll be looking at the suicide by general public, suicide by particular group of people, students. It's a very, very disturbing and important thing we are dealing with now. The role of teachers, parents, and schools, school management will be looking at, and then availability of suicidal material like the pesticide, availability of pesticide, the control over it, sani powder in certain regions of the state. And then I will be interested in talking about the helpline and its limitations, right? There is a helpline, but there are a lot of limitations in using it effectively. And of course, as a police officer, what has been done along with Dr. Ramasubramani to prevent suicides in the police. We started a pilot program way back in 2014 along with Dr. Ramasubramani in Madurai district to prevent suicides in police. And later it transformed into police well-being program, one of the largest program in the entire world for to promote mental health in police. Of course, the credit goes to Dr. Ramasubramani for pursuing it from the beginning and take all steps to translate into action. So with this, I'll conclude my opening remarks. Thank you.
Thank you, Mr. Balakrishnan. Dr. Ramasubramanian, could you take it from there? I mean, your opening remarks. You're muted, sir. You're on mute, sir.
Right.
Muted.
Still, yeah.
No, am I audible, ma'am?
Yes.
Right. No, in fact, I am in the field of mental health for past 50 years, and you will be surprised to know that when I started my practice, I used to get only 1 or 2 attempted suicide cases. That too, once in a month or once in 2 months. And again, you will be you will be happy to hear that age group, the people after the age of 50 and who are having diabetes and BP and who are having unmarried daughters and sons, they will develop an ideas of hopelessness, worthlessness, and guilt feeling. They will try to commit suicide. Now the trend has changed. Our attitude has changed. There is a multifold in the suicidal rate. It is very alarming. Now, every week, I am able to see at least 2 or 3 cases of attempted suicide. That too, again, you will be shocked to know the age group between 15 to 18 who are at the prime age group. And again, you will be surprised to know the reason. It is a very flimsy reason. And most of the students, younger generation, they are not able to tolerate, withstand the stress and strain of the society. And as a mental health professional, I want to stress one important point. All suicidal, curable, and preventable. Identify the symptom very early. If you initiate the intervention very quickly, especially if it is coupled with proper counseling, the recovery will be total. But unfortunately, what is the present situation? Lack of awareness. Many people, they are not aware that it is a mental health problem. And inadequate treatment facility. There is no adequate treatment facility. And inadequate human resources. And again, with respect to human resources, and I want to highlight one important thing is, in the recent mental health survey, the situation in the mental health aspect of the country is very grim. 10.6% of the population are suffering from the serious type of psychiatric illness who are dangerous to themselves, who are dangerous to other people. I am not talking about the minor type of psychiatric illness. I am talking about the serious type of psychiatric illness. You can imagine the population of the great country, 133 million. You can calculate with 10.3%. So you can understand how many people are suffering from the serious type of psychiatric illness. And for such a huge population, now the problem is there are only 9,000 psychiatrists in the entire country. I'm not talking about the state. I'm talking about the entire country, 9,000 psychiatrists. And the entire country, the psychologists, only 3,000 psychologists. Social worker is less, and treatment facility is less, and also stigma. So the end result is, on one side, the need is more, the other side, service is less. Again, I want to stress one important point. All suicide, it is not an individual problem, or it is not an individual family problem. It is a community problem. It is a society's problem. So how to bridge up the gap? By organizing seminar. I'm so happy today you have taken a very good initiative. In the panel, we have got a journalist and law enforcement officers and psychiatrists and the important stakeholders of society. We need such a discussion, and we need we should enlighten the community. So all the people, they should understand that it is a treatable and curable. In short, I want to stress again one important point is the reason for completed suicide is there is no listening ears and no feeling heart. So they are knocking at every doors of the community. There is no response. So they develop hopelessness. They will try to end their life. So in due course, definitely we will have a discussion. So thank you very much for giving us an opportunity.
Thank you for laying it out pretty broadly so that we can take it forward from there, Dr. Ramasubramanian. Kavita, would you like to sort of expand as a media professional, your opening remarks on this discussion?
Yeah. Thanks, Prem. Yeah, like everybody said, it's a very important topic, and this panel especially, I mean, there are 3 people who are actively kind of, fighting to prevent suicides, and the rest of us, you, me, and Rishi, we represent we represent something that seems to be actively contributing to copycat suicides in terms of, in terms of media coverage. That's why we need to talk more about how sensitive the coverage needs to be when it comes to a suicide. Like after Kallakurichi, especially after the funeral, there were lots of similar such suicides. So we need to focus on whether it's possible to regulate such coverage, especially of television channels and social media. I mean, there are several media houses that are also very responsible, that put out the numbers and contact numbers to take help and all. But a large part of media, especially YouTube channels and television channels that are consumed at large levels by large number of people, I think they are behaving in a very irresponsible manner. I mean, the entire coverage is very irresponsible, very insensitive, leading to more such suicides. So as media persons, we need to discuss, if it's possible to regulate such coverage, if it's possible to, kind of negotiate some kind of sensitivity into this coverage. So that's my point. The second point that I wanted to make about is what Mr. Ramasubramanian already spoke about. It's a problem of the society, not an individual problem. And I don't know, if I'm right, suicide is not exactly a mental health issue. It's partly mental health issue. It's also something, a decision taken on an impulse sometimes. Like for example, NEET, the issue of NEET has led to many suicides. It's an external factor. It's not an internal factor. So we need to discuss how to kind of bring about a bridge between these external factors and a person's mental health, and that is a responsibility of the society.
Thank you, Kavita. I mean, that you kind of laid out the purpose for this discussion very nicely. Saptarishi, would you like to take it forward with your opening remarks?
Sure, Prem. Thank you. Hello, everybody. Just to add one point to Kavita's initial remarks was that Kavita very briefly touched upon it. We have a new dimension to the media today, which is a big challenge, which is in the form of social media. The YouTube channels, which Kavita mentioned, is perhaps this one aspect that we need to really focus on and look at how to frame guidelines so that the sharing of information in the media, in that particular media, in the social media, is perhaps within the guidelines. Now, having said that, media guidelines have been quite, it's not new. Having media guidelines for reportage of suicide is not new. And it can roughly be translated into 2 phases. The first phase is perhaps the pre-2017 phase before the advent of the Mental Health Act. And with the advent of the Mental Health Act, what happened was the whole narrative had changed from criminalizing of suicides to perhaps a much more humane approach, as we understand, of dealing with suicide. And we know that Section 309 of IPC, Mr. Balakrishnan would be very aware of it. Section 309 of IPC is still active. And despite the fact that it has been largely restricted by Section 115 of the Mental Health Act. But the fact is, these discrepancies now will have to be ironed out. And that is the challenge ahead of us. Now, everybody here is perhaps a subject matter expert. So I would not delve into much on the subject per se as to what are the causal factors of this thing and of suicide, and perhaps the mental health angle of it. There are experts here to speak about it. I'll speak of one other aspect which is the budgetary allocation for mental health in India. Now, we all know that the health sector gets funding, gets a budgetary allocation of about, if you look at 2022-23 figures, we have a budgetary layout of 86,000 crores, out of which the mental health sector alone had about 1,035 crores. Mind it, it's 1,035 crores, and it is less than perhaps an institutional budget of a size of the IIT Madras and Bombay put together. You understand me? So I'm just trying to locate, or rather trying to draw parallels so that we understand the problem in hand. Now, there is one other aspect that we need to also look at. How much of research has gone into suicide prevention? How much of academic research has gone in? How much of population-based study has gone in? To my understanding, I think the experts would be able to tell us more. In recent times, we have had two studies in two cities, in Chennai and in Bangalore, which are population-based. They use the autopsy, the psychiatric autopsy method, where they went and, people who have died by suicide, they went to interview different, family members and friends and neighbors, and tried to understand and delve deeper into the reason, causality of the action. Now, these kind of what happens with this kind of studies, this gives us a very deep understanding of how we can perhaps approach, prevention, the preventive, the interventions, rather, how we can frame our interventions. Now, those kind of studies will be possible only if we have enough funding from the government. And year on year, we have noticed that funding for mental health, or even for that matter, funding for health sector per se, has been dropping. Today, it is 0.3, if I'm not wrong, 0.324% of the GDP. And it's only 2% of our total budget out, whereas we are supposed to be having ideally 6% of our GDP, which is which is what the target has always been, and every government, successive governments have been talking. So I laid out here. Let's talk about other aspects of it as well, and then visit the macro issues as we proceed. Prem, back to you.
Thank you, Rishi, for kind of bringing the economic perspective to this very, very sort of pertinent and dangerous situation that we are in right now. Because why I say dangerous is, like what Dr. Ramasubramanian was talking about, things have changed immensely from what it was. And Dr. Safia, you were mentioning when we were having a chat before this webinar about how these triggers that Mr. Balakrishnan was talking about, it looks like it's evolving, right? It's changing. We're seeing a very different kind of triggers, the kind of reaction that people are having. You were talking about some patients in terms of self-harm. I think it's becoming much more complex than what Rishi is talking about, the research that is required. So would you like to take this discussion forward from there? We will also go to Mr. Balakrishnan and see how he's taking it in terms of the law enforcement way.
Yeah. As doctor was saying, the completed suicides were lesser and the people coming for attempted suicides are increasing, and the way and the intensity degree is also changing. Now we see kids as young as 12, 13 they come to me with a full sleeves, and suddenly parents don't know, and then they just open the sleeve and show me, see the number of cuts I have done, to cutting on the thighs, cutting on the stomach, just to hide themselves. So the deliberate self-harm, the intent is not to die, but the intent is to express, is much more than a completed suicide, which also needs to be considered, because that could also be fatal. And there are different modes with which now the way the suicide is being presented is, it's being presented in the form of self-neglect. That may not amount to suicide, but the neglect with which the self-harm is happening, like neglecting their academics, neglecting themselves, neglecting their future. So that also is in a way a self-harm. The self-harm tendencies have increased much more. The guiltiness, the guilt proneness is very high. Entitlement is very high. The patience level has come low. Then the way the suicide is being presented also has become different. So typically it may be completed suicide, may look like, okay, he died of hanging, he died of a pesticide, or it could be cutting or immolation, or these are some of the ways. But other aspect of it, which also goes unnoticed, is the deliberate self-harm, and also the pre-things which is happening, like a self-neglect, which is also amounting for a greater loss of functionality, and then the progress, which also needs to be considered.
So, Mr. Balakrishnan, things seem to be evolving even in this space. It's not what we have been. I think we need to start discussing at that evolved level also now. I mean, looking at this whole self-harm in a dangerously dynamic manner.
Yeah. So I was looking at the data on suicide for the last 3 or 5 years, and there is a pattern in the causes which trigger the suicide. Like the major portion of the suicides are committed due to family issues, the internal issues within the family. We all know that because of the economic transitions, the families are going through tremendous changes. The last 2 years have been, COVID times have been extremely difficult in many families. And family problems are the major causes for the suicides. Consistently over the years, this has been the major issue. And among if you look at the breakup, for example, in the year 2021, in Coimbatore city, which is the same pattern is there throughout Tamil Nadu. So in Coimbatore city, for example, 93 men have committed suicide because of family problems in 2021. And 36 women have committed suicide due to family problems. I think though there is a gender angle to it, but overall this family aspect dominates the scene. So strengthening the family counseling, we have in police, all women police stations, and now women help desk to address the family related issues and crime against women. And of course, we realize the importance of strengthening this mechanism further to address the issues relating to the families. And the second major reason for trigger for suicides is the prolonged illness. The illness, we are not able to get into the details of each illness, but most of the time, if you look at the suicide by women, the reason given is stomach pain. But stomach pain is just a reason given. But if you probe deeper into it, there are so many other issues. The stomach pain is a common reason given, but the reasons are something different. But prolonged illness among the people is one of the major reasons for the suicide. So again, the medical health department comes to picture to address this issue. Then again, the third thing is drug abuse, drug or alcohol. Alcohol addiction and drug abuse is the third major reason for the suicides. And now the government of Tamil Nadu is also giving so much importance for addressing this drug issue, particularly among the college students and school students. And this is an important thing. We should look at it very seriously, because it is affecting the younger generation. The future of India is at danger if you don't address these reasons. And in fact, if we look at the suicides by the students also, in the last 3 years, though in the city of Coimbatore, with a population of 16 lakh, the suicides are in the student suicides are in the range of 5 to 10 in a year. but it is still harming because it is again the future of India uh, future of India is our students. So we should seriously look at it. And then the other reasons are major reasons, unemployment and professional or career problems. So these are the main causes we find based on data responsible for suicide. These are the triggering factors. So one way of prevention is to address these issues by the respective departments in a coordinated manner. And I would like to comment upon the media coverage on suicides, particularly the students. I was aghast to see, to see all the media's YouTube channels, so many cameras zooming on the funeral procession of the child in Kallakurichi. And in fact, they were telecasting each and every bit of it to the entire world. I really don't understand what purpose it was going to serve. Because according to me, it was kind of telling the younger generation that, see, especially the children with low self-esteem, we often see that the children with low self-esteem or even the adults with low self-esteem, they are more vulnerable to commit suicide. So the children with low self-esteem, particularly when they see such kind of prominence given to the victim of suicide, they also kind of get an idea that, okay, this is one way of getting into prominence, right? This is one way of getting everybody talking about me, right? So that's how I look at it. I don't know what positive outcome of such media coverage of a young girl, the entire funeral getting covered. So this
maybe I'll take that question. I'll take that question to Kavita, sir. The issue that you've raised. Maybe I'll add a couple of more points before I take it to Kavita. Kavita, we all saw what happened during the NEET suicide coverage. We again in Kallakurichi, and also it's not just a Tamil Nadu phenomenon. In Delhi, when a very famous, very popular star he committed suicide, a young star committed suicide. The way that his sorry, I shouldn't say committed suicide. The way he ended his life had impacted a lot of people. There were a lot of copycat suicide attempts after that also. So where do we stand in the sense that we do understand the issue that Mr. Balakrishnan is raising is a very pertinent issue, but we do understand as media professional, there are pressures for us to stay on this story because probably that day, that's the biggest story and we cannot move away from that. And when we cover a story from all angles, we need to bring in everything. And that time the WHO guidelines are thrown out of the window. A lot of these things get thrown out of the window. How do we, as media professionals, sort of balance that and work in unison with the officers and the doctors who are fighting this tooth and nail?
Prem, like I was actually listening to the factors listed out by Mr. Balakrishnan, the causes for suicide, and a large number were domestic issues. There were domestic issues, health issues, and the kind of suicides that the media we tend to cover are not about these issues. It's not about domestic, like family issues, or it's not about health suicides of health reasons. But we cover, the media covers. We also cover suicides that kind of become sensational for some reason or the other. Because of maybe because of the age factor, maybe because of the celebrity status. I don't know. I don't know if this narrative should change. There should be larger focus on suicide because we need to be sensitive to the fact that I read somewhere today that Chennai is, in Chennai, Chennai, the second largest suicides happen in Chennai after Delhi. I'm not sure if it's true, but I read this this morning. If that is the case, I think as media persons, we need to be more sensitive about covering the larger impact of, covering it in a larger canvas, covering suicides in a larger canvas, and adding even visually, even on television channels, adding, the helpline numbers or suggesting suicide prevention tips. Yeah, I understand the need to kind of chase TRPs or chase, readership numbers and all, but we need to draw the line somewhere. Otherwise, we are losing the plot. We are definitely losing the plot. And the lots of YouTube channels, the way they cover any death in a film industry, any death of a celebrity, it's revolting. It's very repulsive to say the least. So, if the media is not going to come around if we are not going to come around by ourselves, I think we need guidelines and we need regulations. Like we have guidelines on writing about rape that you should, or right. We have POCSO mentions about how you should write on sensitive issues like sexual harassment on children. So we need guidelines to do that. I think that alone will help put media coverage in place. There was some kind of action, I believe, on some YouTube channel some time ago when
that's an important point, Kavita. But
Rishi, I would like to hear him.
Sorry, please complete.
No, I was just saying there was some kind of police action on YouTube channels which violated some act and all. A few maybe a year ago. And I personally believe that cops needs to be consistent in kind of following it up. If there is a violation of any law, by the media, the cops need to take it up. At least issue a warning to the media, or do something like that. Rishi.
Yeah, Kavita, thank you. The thing is, the Press Council of India has, after the WHO has come out with guidelines of how we can perhaps, portray suicide incidents in the media, the Press Council of India, not very long ago, in 2018, had come up with a very, very clear document. In a letter to editors, it has very clearly said, it has laid down the do's and don'ts. In fact, don'ts more than do's. And if I may just read, it says, don't place suicide stories in prominent place. Don't repeat suicide stories. Don't use sensational headlines. Don't normalize suicide. Don't describe the suicide method explicitly. Don't detail about suicide location. Don't use sensational language to describe suicide. Don't use photographs, videos, and social media links. Now, these are essentially for print media. But if we can expand it and bring all the other forms of media under it, the broadcast media, the text, that is the digital media and everything, I think what we get is a very comprehensive understanding of what should not be done. All right. So once we understand what should not be done, I think the job becomes easier. And Kavita, to be honest, it is not the job of the cops. It has to come from within us. Journalists, who should be responsible. Now, I put the onus squarely on the journalists.
I agree, Rishi. I'm only saying when it's not possible, when TRP, we all work we have all worked in mainstream media at different levels, and we all know the pressure we have to undergo. Like when our bosses insist that we should chase the TRPs or readership, we need some kind of intervention at some level. That's what I was suggesting. But I totally agree that we need to be more responsible on our own without any push. Yeah.
Yes, and on that note, I think what becomes really important is to understand that we need right now a national strategy for suicide prevention. And this has been on the demand for a long time. In fact, organizations like Sneha and people leading those organizations, they have been clamoring for it for a long time. And I think what we do need is a code, is a written code, is a strategy or a plan for suicide prevention. In fact, the mental health policy that was, I think, formulated in 2014 came out with several aspects of suicide prevention, but in a much more broader detail. We need to, like right now, perhaps focus much more on the aspects which was highlighted by Mr. Balakrishnan. He looked at last 3-4 years of NCRB data. But sir, to be very honest, for suicide prevention, we still look back at NCRB data. We do not have an out-and-out data set which is specifically generated to understand suicide issues concerning suicide. We only look at NCRB data, and that is a lacuna in our approach to perhaps, I would stress
that's a very
again
good point. That's a very good point.
Research.
How we are, sort of looking at it from the criminal angle. I think we can get Mr. Balakrishnan, as well as, I think before I go to Balakrishnan sir, I think Dr. Ramasubramaniam, you have sort of counseled police officers themselves. I mean, you have sort of looked into the system of the stress that that builds upon officers who are supposed to deal with these cases also, right? So can you throw some light on that, how that went, how that, the mission that you started that Mr. Balakrishnan was talking about, how that went about?
In fact, most of the suicides, the basic problem is inability to handle the stress and inability to face the stress. When they are not able to handle the stress becomes distress. Even at the distress level, when they are not able to handle the distress, it will become disease, and the disease will end in suicide. That is the chronological event. And another thing is, we should keep it in mind, all suicides are nothing but cry for help. See, these people, they are having lot of conflict, lot of anxiety, lot of tension, and they are repressing and suppressing all these things inside their mind. Unfortunately, there is no listening ears and there is no feeling heart. That is the sorry state of affair. And I am extremely happy you asked a very pertinent question. And one of the toughest job, for example, I am a medical person. For me, only seeing the patient, it is a very difficult. There is only a stress point. For police people, it is a continuous stress producing job. There is a link. There are a link between the community and the professionals, and as well as from the safety of the community. And today, if we are able to sleep properly, because of the wakefulness of our police personnel. And we have, but because these the police people, their job is very complex, very delicate, and very tricky. First, they will have to face the community. They will have to face the political people. They have to face the legal people. They have to face the family people, and they have to face the superior officers. And above all, there is no holiday, and as well as there is a 24-hour job, and they will be asked to come to the duty at any time. And another unfortunate thing is, people, they will be definitely they will be questioning, doctor, this is so tough. We thought that the military is very tough, the police is very easy, but in military there is only one leader. In police, it is very, very difficult. They have to pay so many people. And for example, we have initiated one important program. It is one of in the post-independence period. This is one of the mega program. We have initiated stress management program for the police people. There is a police well-being program. We have given the stress management program for about 1.5 lakh population and 3.5 lakh family members stress management program. And I am extremely happy to tell that the father of this program is none other than our COP Balakrishnan sir. Some 10 years back, we have initiated a small pilot study. And at that time, I was the mental health professional. I did not have any exposure to this area. And when we conducted the study, and we were really astonished, many of the police people, they were undergoing stress. And another thing, the worst sufferers are the family members and their children, because they don't have the quality time. They don't have the quality time or quality life. They are silently suffer. And after the conducting the study with the Balakrishnan sir's effort, We
How
have
did your
initiated.
Sir, why don't you continue?
Yes. Sir, what's your question? So now,
Yeah, please continue.
because that Balakrishnan sir's initiative was an eye-opener for us. Now we are conducting the stress management program for so many people. My humble suggestion is, this is not an, as I already told you, this is not an individual problem. It is not a family problem. It is a community problem in which every person has got a stakeholder. You can ask, what is the role of the family? The responsibilities should start from the family. The family people, father, mother, children, they should spend some time, they should spend some quality time. That is most important thing. And another thing is, the parents, they should not treat their children as a mark producing machine. They should treat them as a human being. That is another thing. And again, we should come to the educational institution. Education institution plays a very, very important role. During our period, there is a Guru Chala. During our period, there was a Guru Chela relationship between the teacher and the student. Now you can imagine the present situation. Most of the teachers are harboring a fear of persecution. That is a sorry state of affair. And they are playing a different game. So we should sensitize the educational institution. And again, I want to share my personal experiences. Some few years back in Madurai Corporation, there was a steep increase in attempted suicide. We have initiated one important program with the help of HCL Foundation, Happy Schooling Program, wherein we are doing sensitize the teachers, students, and family members. Now there is a gross reduction in the suicidal attempt. So it is an important role played by the teachers and students and the family members. Is very, very important.
Thank you.
And the third
the intervention is helping, but what I want to understand is, are we intervening at the right level? Because the problems that Dr. Sophia, I'd like to hear from you as to, these great interventions are happening. These are really good to know that there are interventions happening at levels. It is bringing down the numbers to a certain extent, but overall numbers, if you look at it, like Kavita was mentioning, I think Tamil Nadu is number 2 state across India, and India is the number 1 country across the world. Continues to be so. The overall numbers are still rising. Do you think enough is being done?
Yes, sir. In fact, when compared to the other states, I can boldly tell that, sir, the Tamil Nadu is in forefront in dealing with the problem, sir.
I agree. In fact, many of the, I think, schemes that were projects that were launched in terms of intervention were pioneered in Tamil Nadu. I have done some research, and so I agree. I'd like to hear from Dr. Safia, a perspective on what happens at a national level when we're trying to do this. You were mentioning about some specific cases which seem like a very dangerous trend, a very disturbing trend. So is this intervention working?
When we look at the national level, I think the National Mental Health Program is sensitizing a lot of mental health issues. And then at the district mental health programs, the Taluk mental health programs, all of them are making way for making the services accessible to the public and improving the public health services. But then we definitely see a lot of gap between the point of the support given from the public health, from, as Sir was saying, from the trigger to intervention, there's a lot of gap. I think one of the gap what we see when mental health issue per se comes is the availability. Like, for example, even if we know there is a case of their attempted suicide or something, there will be no ambulance. Like if we get a call that, okay, there is a case which needs attention, it could be aggression, violence, domestic violence happening. How do we get them? How do we know? By just talking to them is not going to help, right? Nobody is going to listen to a sweet talk at that point of time. We need to intervene very actively. That's where I wanted a police department to be in the talk, because it's very important. As a mental health faculty, we cannot do anything. We need people, and sometimes going to their houses against the human rights. We cannot go just like that when we get a call. So when we go to their house, there is no ambulance. So sometimes we don't have the police support. So we have to go, retrieve the patient, get them home. Recently, we had to do that. One girl was kind of closing the door. We had to break open the door and then get the ambulance. So these kind of a thing is when Mr. Balakrishnan is talking about the intervention, that's where our action comes into picture. What does the helpline do? Like, for example, helpline got a call that, there's a person in the room trying to hang. Now, what is that we're going to do? We are not going to talk to that person, right? We are now going to look into how to break open, how to call the police, how to take them to a mental health facility, which facility, do we admit or no? Should we go to a public facility or a private facility? Who is going to do all this? Who is going to coordinate the whole thing? So this part of it requires a little more conversation as to what should we do. I mean, what is the streamlining which needs to happen? From the helpline, if we are getting potential calls, how do we connect immediately to police, and which force goes home and collects that person? I mean, at the point of action, who does that? Who goes and knocks the door? And who is the one who is going to get them? That's one end of the story. Another end of the story is who is the one who is picking the call, right? How many people are available in the helpline to pick the call up? How do we train that kind of a population? As Dr. Ram Subramanian was saying, human resource is such a big problem. I don't think a psychologist will be able to, and it is a practical plan to tell a psychologist to sit in the helpline. We don't want any we don't want any fancy people or fancy person. So, meaning that completely technical. We can have lay people, we can have community volunteers, champions of mental health, people who have survived suicide, people who have survived domestic violence, people who have survived of drug addiction, people who have already gone through the pain, people who have that listening ear and helping heart, what sir was talking about. If you can collect all of them in one platform, train them more and more, and have more and more connection between these helplines, police officials, public health services, and people can access these numbers quickly, I think that would be the ideal situation which we want to work towards, to train more and more champions, gatekeepers, more and more, help them with more psychological first aids, and have a very easy connect between the helpline and the police department and the ambulance services. Ambulance services becomes very necessary here. And then how do we streamline this? I think this is something which should come out of this conversation. And, it should happen at the national level, and people should know, everybody who is seeking help should know something like this is available, A, B, C, D, 4. No, we should have a pathway for this. And whoever seeks help should be able to have hope that something will happen. And then whenever there's a help-seeking behavior, I urge the family not to challenge them, not to laugh at them, not to tell they're doing drama. Listen to them. Listening ear and the helping heart and the healing heart will help people to talk more and prevent more suicides.
It's a very, very interesting perspective, Dr. Savia. Thanks a lot for putting that out there. And this conversation, like you say, should definitely happen. Or Mr. Balakrishnan, it's a very sort of thin line, isn't it? You can't criminalize it, but you want police force to enter. It's a tough job for you to negotiate. How do you view this?
Yeah, absolutely. I in fact, 100% concur with what Dr. Safia said. There are so many services to attend to it, but then when it comes to coordination at the field level, there is definitely a problem. There is, in fact, we need a kind of mechanism where we now combine all our resources in a coordinated way for disaster management. For a disaster management now at the district level, there is an incident commander, and there are all the stakeholders, all the agencies which work on disaster management response. they work under that incident commander. So similar kind of setup is required for responding to suicidal calls also. And when it comes to helpline, I have some kind of skepticism about the helpline, because when somebody takes a decision to commit suicide, I don't know how far they will be, interested in calling up a helpline and ask for help.
Exactly.
Yeah. So we should intervene before the suicidal thought itself is formed. We should intervene early in the pathway so that they are not taken to the advanced level of decision making, culminating in suicide. So we, in fact, when I was IG Central Zone, we did an experiment, but unfortunately I couldn't collect data on that. I was listening to Rishi when he said there is, absolutely no research on the suicide, like whether it the causes or response or effectiveness of different strategies. There is no research at all. In fact, there is crying need for a formal coordination, formal, memorandum of understanding between the police department or other agencies involved in suicide prevention with the academic institutions, the universities, local universities, and the field agencies should have a formal mechanism to transfer data from the field to the academic institutions to do research, and from the academic institutions, the findings should come to the field to work on that. So very engaging relationship is required between the academic institutions and the line agencies to promote research and the benefits of research coming to the field. We did a kind of experiment, like see, when we look at suicide prevention, we looked at this because in many families we have come across a situation wherein somebody committed suicide in the family and the other families also develop a tendency to commit suicide. The sensational case we dealt with in Tanjavur, when a girl in a school committed suicide. When we inquired into the background of this, of course, there are so many issues involved, and there are so many views and counter views also. But one hard fact was that the mother of the girl had committed suicide long back, and since then this girl also had been nurturing a kind of tendency to commit suicide. So now we have a data on the people who have committed suicide with the police. How to use that data effectively? One is using it for research. The other is whether we can intervene in the families where the suicides have happened. If we intervene in the form of counseling or taking care of their requirements in terms of the psychological support, societal support in terms of creating a source of income if the head of the family has passed away in suicide. So that kind of support we looked at. So for that, based on the data available, we started intervening, talking to the people, the family members of those families. In fact, I discussed with Dr. Ramasubramani also to bring in all the NGOs who are working on this field, so that, because as rightly pointed out by many of the panelists, we have a huge shortage of manpower. Like a human resource with a trained mind is really a problem. What we call counselors, or the the ability to counsel the people with the suicidal tendency, is highly a specialized job. I really don't find any such professional except very few here and there. So when we ask the NGOs to come with us, join together to address this issue, we couldn't find any suitable NGO to support us. So there is a huge need for developing the human resources who are capable of addressing this issue specifically.
That's that's again a very sort of pertinent point that you're raising, in the sense that, everybody, we all think as journalists, like, Kavita and Rishi, you would agree with me, when we think that at the end of the story, we put out helpline numbers and we think we are doing a great service. I think it's time that we need to go a step beyond that and say, if there are, going by what Mr. Balakrishnan is saying, maybe we should put a line saying that if you want to volunteer, come out and volunteer, because there are people who are really need them, or, do you think that that's helping at all, Kavita, as far as media professionals are concerned?
Yeah, I think that's a brilliant idea, Prem. I think because there are people who might also be willing to help. I have come across many people, like I mean, all of us go to various places, and there are people who feel helpless if there is a suicide happening, and who say, if I could do something about it, I'll be like a happier person. So I think we need to tap into such resources, find people who are willing to do it, and the media could play an active part in connecting those resources with forums that could ideally use them. So I think that's a great idea. Actually, we need to go beyond putting out the helpline numbers and suggesting to people, basically connect the people interested in doing this to the forums that can kind of train them to do it. And by training, like Safia pointed out, you don't have to really undergo a rigorous training. Like everybody says, you just need a kind heart and listening ears to handle these things.
Will that help, Mr. Balakrishnan? I mean, do you want more hands on board, or you want more sensitivity, more understanding of the issue, awareness? In what direction should we be traveling? And Dr. Safia, you can also come in
So, see, the awareness creation again, when you, whatever effort you take, whatever resources you put to create awareness without a target, again, it is, I don't know how far it's going to be effective. So, when we took up this project of targeting the families in which suicides happened, we exactly had this factor only in our mind. Like creation of general awareness, it is like, it's so diluted and it's not going to help anybody. In place of general awareness, we should find out the target groups, vulnerable groups, and the people with suicidal tendencies, and how to find out that. In society, it is very difficult to go out and find out who are all having the suicidal tendencies. So based on maybe the one approach could be like based on the data we have, the families in which suicides have happened, that could be one target group. The other kind of target groups, I think Dr. Ramasubramani will be in a better position to comment to list out the vulnerable groups. For example, I would like to draw a parallel when we took up when we devised the strategy to prevent child sexual abuse. We listed out a set of vulnerable categories. For example, based on the data, we listed out like the single parent or orphan children. Then secondly, mentally and physically challenged children, and then the children of abusive parents. So like that, we listed out the vulnerable children, category of children, and we started targeting them to prevent such sexual abuses, to reduce the vulnerability among such population. So similarly, if we can list out the vulnerable groups, who may end up in committing suicide, then it will be more targeted. For example, again in the school, if you ask me, who are the vulnerable groups? The children with low self-esteem, the children with from the disturbed families. So they should be identified without explicitly, in fact, singling them out from the rest of the students. We should be able to create programs to address their issues. So I feel more targeted approach is required. For that, maybe research or the vulnerable group listing out based on data is required.
Yeah. Another way of looking at it is, so we are conducting one study to identify people with mental illness. So again, the problem comes with the resources. So what we did was we trained the ASHA workers. ASHA workers are somebody who is very connected to the community. They go house to house. They are the people who we put Anganwadi workers. They are at the ground level. And other population which helped which we are working with is the survivors of various violence and sexual abuse and others. And another people who will help us and where we can develop human resource is the traditional healers, spiritual healers. So these are the people in the community go easily to then to a doctor or a counselor. So we have planning to train more and more spiritual healers and traditional healers in recognizing the early signs of mental illness and substance use in suicide too, collaborating with them, not demeaning their work or putting them down, respectfully collaborating with them will make a huge difference because they are at the ground level. And if we are able to do that, and if you can train them in the psychological first aid and able to make them understand how to have a listening ear, how to kind of counsel at the ground level, I think we can bring in a lot more resources. And if they are trained how to persuade, have a meaningful inquiry into suicide, how they can refer, and if we can have a referral system that way, I think streamlining will become more meaningful and something actionable.
That's innovative in a way, the referral system. Dr. Ramasubramanian, is that possible?
Definitely, sir. In fact, I totally agree with our COP's suggestion. In fact, counseling, it is an art, and especially counseling to the suicide people, it is requires some training, and it requires they should deal with it in a delicate way. For example, we have initiated a helpline in Madurai that is Speak To, and we have identified like-minded people, especially who are interested in the social cause and the mental health aspect. And we gave them training for 1 month by Nimans, especially how to deal with the people and how to approach the people and how to solve the problem. And another important thing is for giving counseling to the suicide people, the counselor should have some maturity, and the counselor should have some basic knowledge. So the simple solution is we should we should create an inbuilt counselor. That is very, very essential. For example, teachers are the best people. We have identified the good teachers in the education institution. We can train them in counseling, and in fact, they will become the school counselor in their school. So they will be able to identify the small problem changes in the behavior in the student, and they will initiate the counseling at the earliest possible time. So for a developing country like India, wherein the need is more when the service is less, my personal feeling is we should build lot of inbuilt counselors, then only the problem is going to be solved. And another humble request is for the media people, don't glorify the suicide, and don't make them the people who have completed the suicide, don't make them as a martyr. That is a very, very bad example. So every person has got an important role. And another important thing is, in the entire country, we have started a separate suicide prevention center in Chennai, which is called as Mahilchi exclusively for the police people. And we have identified 826 people who are under stress, and we call them one by one. We have analyzed them, and we have given the counseling, and we have given them the intervention. I'm extremely happy to tell you that, and we have prevented most of the suicides, because this is an ideal example. And also we have created a helpline, and our counselors are available at any time. And again, I wanted to tell you that the suicides, before committing suicides, and they will plan. And we should educate the public about the signs and symptoms of the suicide and attempters. And because if they know the suicidal signs and symptoms, they will take certain precautions. And another thing is, our COP correctly pointed out, in one family, the student committed suicide. For few years back, her mother committed suicide. If we have conducted a psychological autopsy after the mother's suicide, we could have prevented this calamity. So every suicide is so that we should conduct a psychological autopsy. Just like for illness, we are doing for any disease, we are conducting a biopsy. to find out the exact cause. Just like that, we should do a psychological autopsy by a trained counselor. Suppose if any person commits suicide, our counselor, they should make a visit. They should the acquaintance with the situation, and they should allow them to talk. We should find out the exact reason. Then we should solve the problem. All suicides are coming from a pathological environment. All suicides are coming because of the diseased environment. So we should treat and we should change the environment. Then only we can prevent the future suicide.
Very interesting point, Dr. Ramasubramanian. Psychological autopsy. Rishi, Rishi, you have, you've been looking at a lot of, at least whatever research papers on copycat suicides are there so far internationally and all that. Have you come across anything like psychological autopsy? Is it possible? And I think it all circles back to that one point that you're talking about, the lack of resources to run all this.
You're right, Prem. In fact, I did mention in my opening remarks that I came across two studies which were conducted in 2007 in the cities of Chennai and Bangalore. The methodology adopted was psychological autopsy, and they looked into several deaths. In fact, they looked into about 20 to 30,000 deaths each, and half of those deaths were actually the suicide was the cause for half of those deaths. So they went deeper into that and try to understand. We know that it's suicide is multidimensional and multifactorial. So they tried to understand all the factors that perhaps could have led the person to take this extreme step. Now, this is again not very definitive, but definitely a pointer on which we can start working. And I would again stress here, yes, there are ideas. Yes, there are lessons that can be learned from abroad as well, which can be perhaps fine-tuned and implemented here. Austria, for example, they mandated that survivors, people who have had suicidal thoughts and have overcome that, and then these survivors, they started talking, they started coming out in the open, they started volunteering. Their stories, success stories, were published across media. That helped in bringing down suicides. However small, the number is significant. There are lots of these small lessons that we can learn. For example, in Kerala, in 2018, the government of India banned 18 different pesticides from manufacture and distribution and sales. In Kerala, subsequently, there was a small drop in the number of suicides. So, you see, these are all, it cannot be causation. These are all correlation as of now, because we are just correlating two different figures. We need to understand the causality, for which deep research is absolutely necessary, for which funding is necessary, for which the government, the central government, and the state governments will have to seriously look at mental health as a subtopic which is of prominence. And as I said, 1,035 crores for a budgetary allocation, this thing will put pressure on Mr. Balakrishnan and his police force to work here in this sector as well. Police already have law and order and crime, two very, very massive sectors to work on. In addition, they are helping with it's part of the whole integrated approach. Yes, I can understand, but the fact is, they are not the primary responders. We need to create institutional systems, and that is where I think the focus should be on strengthening the district level mental health program.
So, Rishi, interestingly, good that you brought that point, because one of our viewers has asked this question to have, I think this pertains to all of us. Kavita, the point that you were mentioning, referring to briefly, is it possible to have officials at the local level double up? I guess when they say officials, they're meaning as representatives at local levels, double up as people whom anyone can, anyone with suicidal thoughts can approach and seek help from. As in, I guess this question sort of relates to the social aspect of everybody coming together and sort of being of help for one another. Is that possible? Kavita, I'd like to start with your thoughts at the ground level, and then we'll reach out to Mr. Balakrishnan and the doctors. You're muted, Kavita. You're muted.
No, it's, if they are talking about, say, someone like a district collector or a commissioner of police, I'm not real, or an MLA or a or a panchayat president. I'm not really sure if it's possible, given the scale of work that the people in those positions might have to do on daily basis. So offering counseling, they might be able to direct these persons to another appropriate forum, but for them to personally intervene and to take action in these cases might I think it's not really feasible to do this.
But what about social workers or like what?
Yeah, there could be volunteers, there could be social workers, yeah, who could act as bridge between appropriate forums that could help these people and the people who need help. And as I said, these volunteers need to be trained on how to kind of handle people with suicidal tendencies, because as someone pointed out, rightly pointed out, the way you talk, anything you say is likely to affect them. So we should make sure that it affects them positively, it impacts them positively, rather in the opposite way.
Dr. Sophia, you think that's one of the solutions, that we can look at community participation, but there is a lot of risk involved also, I guess, like what Kavita is pointing out. If you aren't really trained to do it, then you might sort of do more harm.
Yeah, community participation is the only way, actually, because if you look at the number at the ground level and the need for the counsellors, if there is no community participation, nothing will go ahead. If at all we are planning at a larger scale and at a cost-effective manner, if we have the people with the right intent, I think if the intentions are good, skill is trainable. It's a trainable skill. It is by giving a psychological first aid training, gatekeepers training. It is a trainable model which we can train and keep kind of improving on that. But what matters is the intent and the commitment what the people have at the community level. And if you get the right set of people, I think community participation is the only way forward.
Mr. Balakrishnan, what do you think?
Yeah, so as Rishi and others pointed out, definitely there is a requirement for an institutional setup to respond to the suicides at the district level. And since district collector is the head of district administration, there can be a committee under the district collector with the superintendent of police as the member secretary. This committee can include all stakeholders, the elected representatives, local representatives of the local bodies, social workers. I visualize it in the format of the road safety committee. In the road safety committee, all those people who are connected with road safety, including the road users, everybody is represented in such committee. So a similar committee can be formed at the district level, and a periodical meeting, monthly minimum, quarterly, quarterly minimum, monthly maximum. So similar periodical regular review based on whatever findings we have based on the psychological autopsy after suicides. Every month, if you say, for example, 10 cases of suicide you get in a district, all the reports of psychological autopsy in those cases can be put before this committee, and the reasons can be addressed, right? The causal factors can be addressed by these committees. So an institutional mechanism with people who can influence the top administrators of the district, along with all the stakeholders. That will be a working mechanism, I think.
Very interesting. I'll quickly get your closing remarks, Dr. Ramasubramanian. I'll start with you, but before I get into your closing remarks, just one quick point, I think, which I really wanted to discuss, but we didn't have the time, is what Rishi raised about a national guideline. Maybe it sounds like a very broad thing, but I don't know if any one of you in your closing remarks want to touch upon it. It'll be great. But that's one interesting point that came up. I think the government is already working around it, but how long it's going to take to implement something like that, we don't know. But Dr. Ramasubramanian, I'll start with your closing remarks, and then we'll go and take everybody's views. You're muted.
In fact, I am extremely happy to tell you that in Tamil Nadu, in all the district headquarters, we have got a psychiatrist and a psychologist and a social workers and psychiatric clinic. And now the days come now wherein at all taluk headquarters also we have got a psychologist, and in all the 32 districts we have established a district mental health program wherein district psychiatrists, counselors and psychologists, they are going to the taluk headquarters hospital, they are conducting the clinic and they are conducting the awareness program. And under in each district, under the chairmanship of district collector, we have got a district mental health committee, wherein the district collector, joint director, deputy director, and the psychiatrists are the members, and other important stakeholders are the members. And definitely, they are reviewing the mental health problems of the districts almost every month. And again, we have got a helpline, 24 hours helpline. It is available in Tamil Nadu. And again, at the district level also, the helpline is available. If suppose if any person, if they contact whether they contact the bureaucrats or administrators or law enforcers, and they can direct to the helpline, and the helpline counsel, they will intervene and they will give the proper solution. And also, I'm extremely happy to tell you that only in India, at the PhD level, psychiatric medicines are available. At the PhD level, primary health center level, we have got psychiatric medicines, and all the PhD doctors are trained in counseling and also in dealing with the suicide prevention method. But only thing is, the only thing, the need is more. So how to the bridge of the treatment gap is to bring into the community, especially policymakers, bureaucrats, and the law enforcement, medical people, education institution, and the students. When they joined in this movement, definitely there will be a permanent cure and permanent solution for this perennial problem.
Thank you so much. Thank you so much for your closing remarks, sir. Kavita, you want to go next to sort of wrap up?
Yeah. I just wanted, I just want to say we cannot, all of us, Rishi, you and I cannot stress enough on the need for the media to kind of rediscover itself in terms of suicide coverage in the media, to kind of, self-regulate and make sure that we also have a decent, proper and good role in stopping or preventing the suicide. I forgot to I forgot to mention about portrayal of suicides in cinema, in television serials, and I think we should also need, it's too late now, but I think we should have taken into account the portrayal of suicides. Yesterday I saw a Malayalam movie where they had carried a script saying abuse against women is a violation of law. Maybe such announcements in television serials and cinema will definitely help. So ultimately I think the media needs to be more responsible and realize its the importance of its role in prevention of suicide and act accordingly. Thanks so much.
Thank you, Kavita. Very interesting point. Maybe like a statutory warning when you say, alcohol is,
right, yeah.
Consuming alcohol is bad for health. Similarly, if there is a suicide scene, maybe a warning which says, if this could trigger, I don't know, maybe researchers can come up. What do you think, Rishi? And your closing remarks, Rishi?
Yeah, this is something which is the bare minimum we can do, to start off with. A disclaimer, a statutory disclaimer, which is which goes which goes with every action that is portrayed. We can't really ask them to not do so, primarily because it's they would hide behind artistic freedom and stuff like that. And it's also very pertinent to understand that there are certain liberties that this particular medium can take. And these disclaimers, yes, definitely there is something that we need to talk about more. And my closing remarks would be actually just 2 points, or rather 3. 1, increased allocation for mental health. Now, only through increased allocation, budgetary allocation, can we actually have ground level or grassroots level programs going. Second, every panelist here spoke about a scaffolding approach to support for either mental illness or suicide prevention. Now for that, we actually need a whole integrated approach from people in society, people in family, and the individual concerned. And how do we do that? We do that through a mechanism, through a structure, an institutional structure. We do not have that. We do have that in certain districts. We do not have that in every district in India. That is important. Tamil Nadu is far ahead. Yes, Dr. Ramasubramanian, Dr. Sophia has time and again mentioned how well, the district level program, mental health program in Tamil Nadu has been functioning. And but we need this kind of uniformity across India to basically bring down the incidents and also integrate the people who have come out of suicidal thoughts, integrate them into this whole movement so that they can also bring in a perspective and help heal. That's one point. And yes, third point is me agreeing with Kavita wholeheartedly, and perhaps hoping that Dr. Sophia started her inaugural remarks by saying hope through action. And I think, yes, each sector, we are multi-sectoral, we've come from different sectors, but each of us are stakeholders. We provide hope through our own actions. And that is what we need to do. Prem.
Thank you, Rishi. Dr. Sophia, your closing remarks before I come to Mr. Balakrishnan.
Yeah. So if at all we have a mechanism where we are able to train each individual to proactively inquire when they say somebody not well, showing red flags, if they know how to inquire, ask them, how are you? Should I help you? Can we do something? And if they have enough courage or time and patience to persuade that individual to talk more, and then have the ability and the system to refer them to the right people, and we have more and more people involved and work collaboratively as we are discussing now, I think we can prevent suicide to a much large extent, and that is not an impossible task. I think this should be a beginning. We should have more such communications, open discussions, have more stakeholders along, and then take it ahead so that we can have a safer place for our children. Thank you.
Thank you, Dr. Sophia. Very nicely put. Mr. Balakrishnan, your closing remarks.
Yeah. So when we talk about the national strategy for suicide prevention, I have a different view on that. Like maybe at the national level, we can have a broad policy guidelines about suicide prevention, but suicide prevention should be more decentralized, at least at the state level. If we look at the data on suicides, probably Tamil Nadu, Kerala, Maharashtra, so region-wise, geographic region-wise, based on probably demographic factors, the suicidal pattern differs. So more of a decentralized strategy should be followed to address the issue of suicide, because it's more of cultural and personal reasons which broadly are responsible for the suicides. That is one thing. The second thing, one major problem in addressing the people with the problems of people with suicidal tendencies, there is a stigma around counseling. If somebody goes for counseling, there is a great stigma around them, and destigmatizing the counseling is an important step we should all consider to address this issue. So probably an anonymity is required for the counseling, or there should be an acceptance in the society that mental health issue is like any other health issue, and counseling is a way of addressing that. Say, for example, when I was in the UK for my post-graduation at the UCL, I just wanted to check how the mental health counseling system works in the university. There is, of course, a separate robust department to take care of the mental health issue of the students. And I just enrolled myself in the program, and I went and experimented how does it work. So in fact, I told about few issues, and then they gave me a time slot of 6 weeks. They called me once in a week for 6 weeks continuously. And it is not nobody feels like it's a bad thing or negative thing to walk into the counseling room. So that kind of general acceptance of counseling as a kind of solution for the suicidal issues, that should come. So destigmatizing counseling is an important step we should actively consider. So with that, I'll conclude. Thank you very much, Prem.
Thank you so much, Mr. Balakrishnan. I think one thing is very clear, that every single person on this panel really wants to save that every single life here that we might lose to something as grave as suicide. But clearly, the time that we have is just not enough for such a massive discussion. But we will continue these conversations. Like all of you are saying that your interests are clear, your intentions are clear. But again, like Rishi was saying, maybe we just don't have enough resources. But constant pushing of this idea will eventually get us. And who knows, maybe we'll have a 108 for a kind of ambulance facility for a suicide, for somebody who needs help. So a lot of things can happen if all of us can come together. Anybody who might have who might be watching this recorded version, if you have any troubles, we will be displaying helpline numbers below below this video. Also, please do reach out if you need any help. And I just can't thank enough Dr. Ramasubramanian, Dr. Safia, Kavita Muralidharan, Saptarishi Bhattacharya, and Mr. V. Balakrishnan for having participated in this. Really nice of you. We will continue these conversations, and we will reach out to anybody who's dropping their comments or want to have any suggestions, want to make any suggestions, give us any suggestions regarding this. We will reach out to each one of you to ensure that